Doctors warn, 4 vitamins that may lead to paralysis, osteoporosis and silent strokes. Seniors, avoid these now. After the age of 60, there's a truth few are willing to face. The body no longer responds the same way to things that once seemed beneficial. A vitamin that used to symbolize health can now become a hidden danger if taken improperly. Many older adults continue to take a variety of supplements daily, believing that a little extra won't hurt. But that very little extra, when repeated over months and years, can lead to disruptions that doctors call silent damage. After middle age, the body's ability to absorb, process, and detoxify changes. Vitamins often seen as harmless can contribute to osteoporosis, liver or kidney damage, or interfere dangerously with prescription medications. What's most unfortunate is that many of the health issues we see in clinics start with one simple behavior: taking vitamins based on gut feeling, without blood tests, and without professional consultation. That's why this message is not meant to condemn any vitamin, but to raise a serious warning. Once you reach retirement age, choosing the right vitamin, at the right dose, in the right health context is no longer just advice, it's a survival principle. These 4 seemingly familiar names may actually turn against you if taken without proper control. Watch this video to the end to find out whether you're supplementing vitamins the right way or unknowingly harming your body. Don't forget to leave a comment with your thoughts. Your experience might help others too. And subscribe to the channel to explore more health-related videos with me. 4 vitamins that destroy the health of the elderly. 1. Vitamin A, light or shadow for seniors. The true role of vitamin A. Vitamin A was one of the first vitamins ever discovered and is essential for vision, immunity, and skin health. It exists in 2 main forms. Retinol, animal-derived, found in liver, eggs, and dairy. Beta-carotene, plant-derived, found in carrots, pumpkin, and leafy greens. The human body can convert beta-carotene into vitamin A as needed, a self-regulating and safe process. But retinol from animal sources or supplements is different. It doesn't self-regulate, and when taken in excess, especially in supplement form, it accumulates and can lead to toxicity. Why vitamin A can be risky for seniors. Multiple clinical studies in the US and Europe have shown that older adults are more prone to vitamin A toxicity due to weaker liver function, limiting retinol metabolism, reduced excretory ability, potential interactions with other medications. Common side effects of vitamin A overdose: headaches, dizziness, nausea, insomnia, loss of appetite, osteoporosis, brittle bones, increased fracture risk, liver bile digestive imbalances. Professional recommendation: safe upper limit for adults over 60, maximum 3000 mcg/day. Avoid retinol supplements unless prescribed by a doctor. Prioritize natural beta-carotene sources. Carrots, pumpkin, spinach, mango, papaya. Avoid eating animal liver more than once a week if taking any vitamin A supplements. Expert insight: the light of vitamin A can guide your health, but when too bright, it may burn your bones, liver, and the freedom to move in old age. Don't let blind faith in a pill cost you the independence you've worked your whole life to protect. 2. Vitamin E, the hero that turns on you in high doses. Vitamin E, a cellular guardian. When taken correctly, vitamin E has long been hailed as an anti-aging superstar in preventive medicine. Its primary role is to neutralize free radicals, protect cell membranes, and support skin health, immunity, and cardiovascular function. For younger individuals, Proper supplementation can aid tissue repair and slow oxidative damage. However, for older adults, vitamin E becomes a double-edged sword. In high doses, especially from supplements, it can delay blood clotting, trigger spontaneous bleeding, and interfere with anticoagulant medications that many seniors rely on. From antioxidant to bleeding risk. Many older adults take vitamin E hoping to stay young longer, brighten their skin, or strengthen the heart without realizing that vitamin E naturally thins the blood. If you're already taking aspirin, warfarin, or clopidogrel, adding high-dose vitamin E is like pouring fuel on the fire. Increased risks include unexplained bruising, even without injury, persistent nosebleeds, gastrointestinal or intracranial bleeding, especially when multiple drugs are involved. A study from the American Heart Institute found that vitamin E doses over 400 IU/day increase the risk of death in older adults with a history of heart disease or blood clotting disorders. Not just blood, vitamin E affects digestion and nutrient absorption too. High doses of vitamin E over time can also cause digestive issues, nausea, diarrhea, bloating. Interference with absorption of other fat-soluble vitamins, like A and K. Increased risk of deficiency in nutrients essential for bone and nerve health. Expert safety guidelines. Recommended daily intake for seniors, 15 mg, 22 IU. Avoid high-dose vitamin E unless prescribed by a physician. Best sources: whole foods like O almonds, sunflower seeds, hazelnuts. O spinach, broccoli. O cold-pressed oils, olive oil, sunflower oil. A deep medical insight. If oxidative stress is the silent enemy of aging, then the right dose of vitamin E is the body's shield. But in high doses, that protector becomes a destroyer of blood vessels. Anti-aging isn't about maxing out on supplements. It's about knowledge and balance. Don't let marketing hype lead you to risk your life with unnecessary pills. Let your doctor determine the dosage, not your guesswork. 3. Vitamin D, the artificial sunshine in a pill. Vitamin D, sunlight for bones and immunity. Vitamin D is often called the sunshine vitamin because the body can synthesize it when the skin is exposed to ultraviolet rays from sunlight. Its primary role is to enhance calcium absorption, helping maintain bone density and reducing the risk of osteoporosis and fractures in older adults. It's also linked to boosting immunity, reducing systemic inflammation, supporting muscle and nerve function. However, when sunlight is replaced by supplements, many seniors unknowingly turn sunshine into a silent toxin. When sunshine is trapped in a blister pack. A concerning reality. Many older adults self-prescribe high doses of vitamin D, often 5,000 to 10,000 IU/day, thinking it's great for their bones. But they don't realize the body can't easily eliminate excess vitamin D like water-soluble vitamins. Excess vitamin D equals elevated blood calcium, hypercalcemia. Prolonged high calcium equals calcium deposits in kidneys, heart, and blood vessels, rightward arrow leading to organ damage. Symptoms of vitamin D toxicity include nausea, loss of appetite, constipation, muscle pain, weakness, fatigue, bone and joint pain, ironically, the very reason they started the supplement. Kidney damage or kidney stones from calcium buildup. A deeper medical insight. Vitamin D is the sunlight of health, but if you turn that sunshine into a spotlight pointed straight at your eyes, you're no longer nourishing your body, you're burning it under the illusion of wellness. Yes, seniors need vitamin D, but they need the right dose, in the right way, and for the right reasons. Not everyone is deficient, and no one should take high doses for long periods without blood testing. In medicine, even the best things have conditions. The right dose, for the right person, at the right time. 4. Vitamin K, a double-edged sword for those on blood thinners. Vitamin K, the guardian of bones and blood vessels. Vitamin K is an essential micronutrient that plays a central role in normal blood clotting, helping wounds stop bleeding quickly. Bone remodeling, directing calcium to the right places in the body. Preventing arterial calcification, keeping calcium out of blood vessels and soft tissues. There are two main forms of vitamin K. K1, phylloquinone found in leafy greens like spinach, kale, and broccoli. K2, menaquinone found in fermented foods, example natto, cheese, egg yolks, and liver. While seemingly harmless, for people taking blood thinners like warfarin, Coumadin, vitamin K can counteract the medication, causing blood to thicken unexpectedly, increasing the risk of stroke or heart attack. When vitamin K poisons the life-saving drug. Blood thinners like warfarin work by inhibiting vitamin K, thereby thinning the blood and reducing clot formation. However, if you suddenly consume large amounts of K1-rich vegetables or high-dose K2 supplements, vitamin K can neutralize the drug's effect, leading to faster clotting, completely reversing the intended therapy. Consequences include ischemic stroke, from blood clots in the brain. Deep vein thrombosis, DVT. Heart attack due to blocked coronary arteries. The issue isn't vitamin K itself, but the inconsistency. One day eating heaps of steamed greens, the next avoiding them completely. This fluctuation destabilizes the treatment plan. Is vitamin K dangerous? Not if you understand it. Vitamin K remains vital for bone density, especially K2, which helps direct calcium into bones instead of arteries. Reduces risk of fractures and osteoporosis in seniors. So, if you're not on blood thinners, vitamin K is your ally. But if you have a medical condition, work closely with your doctor. If you're healthy, supplement wisely and moderately. Avoid high-dose pills unless necessary. Expert insight. Vitamin K is like the conductor of a symphony between blood and bone. If the orchestra includes blood thinners, the conductor must be precise. Because one wrong note can shatter the harmony of your health. Next, 4 essential vitamins that seniors should prioritize to boost health, extend longevity, and maintain independence in daily life. 1. Vitamin C, the loyal friend of immunity and connective tissue. Vitamin C, the first line of defense against aging. After age 60, the body's natural responses begin to slow down. Wounds take longer to heal. The skin becomes dry, wrinkled, and thin. Colds last longer, and even a light stumble can lead to sprains or bruising. At the root of these signs, weakened collagen and a declining immune system. That's where vitamin C, ascorbic acid, plays a crucial role. Promotes collagen production, the structural backbone of skin, tendons, bones, and blood vessels. Strengthens the immune system by supporting white blood cell function. Acts as a powerful antioxidant, shielding cells from damage. Improves iron absorption from plant-based sources, helping prevent anemia. Why older adults are prone to vitamin C deficiency. Eat fewer fresh fruits and vegetables due to weak teeth or digestive issues. Overcooking destroys much of the vitamin, boiling may reduce up to 60%. Smoking and chronic illnesses increase the body's vitamin C demands. Diuretics, water pills, can flush vitamin C out through urine. Deficiency symptoms include dry skin, easy bruising, delayed wound healing, bleeding gums, weak teeth, joint pain and reduced tendon flexibility, fatigue, lowered immunity, rightward arrow, frequent infections. Supplements aren't always better. Effervescent vitamin C tablets often contain 500 to 1000 milligrams per dose. They're easy to take but also easy to overuse. Taking high-dose supplements daily while eating little fresh produce leads to imbalanced nutrition, as you miss out on fiber, flavonoids, and other essential minerals found in whole foods. Unless prescribed for a specific condition, it's best to get your vitamin C from real food. It's more bioavailable and beneficial for your digestion and metabolism. Expert advice. Vitamin C isn't a miracle drug, but it is a solid foundation for healing, resistance to illness, and maintaining vitality in old age. Start with the simple things. An orange, a bowl of sliced guava, or a handful of fresh greens. And you're helping your body heal, every single day. 2. Vitamin B12, the defense against muscle loss, memory decline, and fatigue in old age. DNA. Vitamin B12, a vital nutrient for brain and muscle health. Vitamin B12, cobalamin, is a water-soluble vitamin involved in many critical biological processes. Red blood cell formation, DNA synthesis, maintenance of the myelin sheath, which protects nerve fibers, energy metabolism and muscle strength support. In younger people, B12 deficiency is rare due to efficient absorption and diverse diets. But among seniors, B12 is one of the most commonly deficient micronutrients, and its effects go far beyond fatigue or muscle aches. Untreated deficiency can lead to confusion, memory loss, nerve damage, and even urinary incontinence if not diagnosed and treated promptly. Why older adults are prone to vitamin B12 deficiency. Reduced stomach acid production, rightward arrow, impairs absorption of B12 from food. Chronic atrophic gastritis, common in the elderly. Long-term use of antacids or proton pump inhibitors, PPIs, rightward arrow, interferes with B12 absorption. Vegan or strict vegetarian diets, rightward arrow, lack natural B12 sources from animal products. Warning signs of B12 deficiency in seniors. Chronic fatigue despite adequate sleep. Tingling or pins and needles in hands and feet. Muscle weakness, reduced tone, unsteady gait. Memory loss, forgetfulness, confusion. Smooth, red, painful tongue. Depression or unexplained anxiety. Long-term B12 deficiency can lead to irreversible nerve damage, even if supplementation is started later. Note for vegans/vegetarians. Natural B12 is only found in animal-based foods, so routine supplementation is essential under medical guidance. Expert insight. Vitamin B12 is the silent current that powers memory and strength. Lose that current and the body disconnects, from nerves, from clarity, from mobility. If you're over 60, especially if you feel fatigued, experience nerve symptoms, or take digestive medications, check your B12 levels regularly. Don't let a small deficiency steal your mental clarity and independence in your golden years. 3. Vitamin A, your old friend that may be silently damaging your bones. What you think is beneficial may actually be a hidden burden. Are you taking a vitamin A supplement every day, believing it helps your eyes and skin? Do you already consume animal liver, eggs, milk, and still take vitamin A pills to be safe? If the answer is yes, pause for 5 minutes and watch this video carefully. Because vitamin A might be silently weakening your bones, muscles, and liver without you knowing. The danger of vitamin A isn't deficiency, it's overdose. In medicine, vitamin A is essential for vision, skin regeneration, and immune support. But vitamin A is a fat-soluble vitamin, meaning your body cannot easily flush out the excess like it does with vitamin C or B. Instead, it accumulates in the liver and fat tissue over time. Chronic overdose can lead to liver damage, osteoporosis especially in hips and spine, loss of appetite, nausea, dizziness, headaches, dry skin, hair loss, and muscle weakness. Vitamin A comes in two forms. Which one are you taking? Type: source: absorption behavior. Retinol: animal products, supplements absorbed directly. Rightward arrow: easy to overdose. Beta-carotene: carrots, pumpkin, leafy greens converted as needed. Rightward arrow: body self-regulates. The risk lies in retinol found in pills and animal products. When consumed in doses above 3000 mcg/day, especially long-term, it can cause chronic vitamin A toxicity, often without obvious symptoms until it's too late. Expert insight. Vitamin A is a friend, but a friend with boundaries. If you don't know where the limit is, that friend can become a silent destroyer of your bones, liver, and long-term health. 4. Vitamin E, the antioxidant warrior that may disrupt circulation in old age. One small pill, one big risk often overlooked. In the world of vitamins, vitamin E is often celebrated as an anti-aging warrior, praised for beautifying skin, supporting heart health, and boosting immunity. Many seniors, especially women, take vitamin E daily as a routine defense against aging. But did you know that misuse or overuse of vitamin E can turn it from a helpful ally into a serious threat to your circulatory system, causing abnormal bruising, internal bleeding, or even hemorrhagic stroke? Vitamin E, a powerful antioxidant that needs boundaries. Vitamin E is a fat-soluble vitamin, most commonly found as alpha-tocopherol. Its main benefits include protecting cells from free radical damage, maintaining healthy skin, eyes, and brain function, supporting immunity and blood circulation. But at high doses, vitamin E can inhibit blood clotting excessively, especially when combined with anticoagulant medications, aspirin, warfarin, clopidogrel, leading to higher risk of internal and external bleeding, reduced clotting ability from minor injuries, increased risk of hemorrhagic stroke, particularly in those with heart conditions. Warning signs of vitamin E overdose: frequent unexplained bruises, even without impact, bleeding gums, persistent nosebleeds, abdominal pain, mild diarrhea, bloating, fatigue without clear cause. If you're on blood thinners, these symptoms could escalate into life-threatening complications. Expert insight. Vitamin E can be a hero, but if it oversteps its role, it becomes a saboteur of the very blood flow that keeps you alive. If you are taking heart medications or blood thinners, have a history of abnormal bleeding, taking high-dose vitamin E, greater than 400 IU/day, pause. Get a blood test. Consult your doctor immediately. After age 60, bones begin to lose mass. Only when vitamin D3, K2, calcium, and physical activity are combined, can your bones truly be protected. After age 60, vitamin supplementation is no longer just a take it if you want choice. It must become an informed medical decision. Some vitamins like A, E, D, and K can harm your bones, liver, blood, and heart if taken incorrectly. Meanwhile, vitamins like C, B6, B12, and K2 are key to preserving your health, memory, mobility, and immunity when used at the right dose and at the right time. Remember, no pill is more powerful than your own understanding. If you found this content helpful, don't forget. Click subscribe so you won't miss our in-depth health tips for aging well. Leave a comment below if you're dealing with vitamin issues or want personal advice. Turn on notifications to receive new weekly videos that help you and your loved ones live longer, live healthier, and live with confidence.